Hello friends, welcome to Neha Thakur channel. Today topic is emergency drugs or life-saving drugs. Introduction. Emergency drugs are used in patient during life-threatening conditions so that the symptom can be controlled and the life of a patient can be saved. For a drug to be used in emergency, it must have a short onset of action. Life-threatening conditions are like diabetes mellitus, severe allergy, seizure disorders, cardiac arrest, etc. Onset of action is the duration of time it takes for a drug's effect to come administration. Next is the purpose of emergency drug: to save the life of the patient, to control the symptoms of patient, to provide treatment illness and injuries, most of which may be life threatening, to normal the vital and body functions. Main purpose of emergency drugs: to treat the ill patients from life threatening conditions and maintain the body vital signs and functions. Here first emergency drug is atropine. Indication and dose of the drugs: sinus bradycardia, dose is 0.5 to 1 mg, repeated every 3 to 5 minutes when necessary in adults. Bronchospasm, dose is 0.025 mg per kg in 2.5 ml by nebulizer 6 to 8 hours. Next is the organophosphate poisoning: 2 mg IV per IM every 3 minutes, and according to clinical response in adults. And next is the cardiac arrest. Dose is 1 mg every 3 to 5 minutes. Sinus bradycardia is a type of low heart rate. Normal heartbeat is 60 to 100 times per minute at rest. In sinus bradycardia, the heartbeat is less than 60 minutes per. What is bronchospasm? Bronchospasm is a sudden constriction of the muscles in the wall of the bronchioles, in which difficulty in the breathing. Organophosphate poisoning is poisoning due to organophosphate. Organophosphate are used as medication and nerve agents. Cardiac arrest is sudden unexpected loss of heart function, breathing and consciousness. Next is the side effect of atropine: palpitation, dry mouth, blurred vision, urinary retention and constipation, tachycardia, arrhythmias, hallucination, and increase or rise intraocular pressure. Arrhythmia means irregular heartbeat, and hallucination is a perception of hearing, seeing, touch, smell, taste something that was not actually there. Intraocular pressure is the fluid pressure inside the eye. Normal eye pressure range from 10 to 21 mmHg, and ocular hypertension is an eye pressure of greater than 120 mmHg. Next emergency drug is aminophylline. Indications and dose of the drug: symptoms of irreversible airflow obstruction associated with asthma and other chronic lungs disease, for example, chronic bronchitis. Chronic bronchitis is long-term inflammation of the bronchi, and dose is 5 to 7 mg per kg IV per oral. PO means per oral for over 20 minutes. Aminophylline side effect: diarrhea, nausea, vomiting, skeletal muscle tremors, tachycardia. Tachycardia means increase the heart rate. Acute MI, seizures. Next emergency drug is Manitol. Indication and dose of the drug: cerebral edema by IV infusion as 1.5 to 2 gram per kg, infused over 30 to 60 minutes. Raised intracranial or intraocular pressure by IV infusion as 1.5 to 2 gram per kg, infusion over 30 to 60 minutes. Manitol is a diuretic that is used to reduce swelling and pressure inside the eye or around the brain. Cerebral edema is when fluid build up around the brain, causing an increase in pressure known as intracranial pressure. Next is the adverse effect of drug: fluid and electrolyte imbalance, circulatory overload, chills, fever, chest pain, acute renal failure. Next drug is heparin. Indication and dose of drug: deep vein thrombosis and unstable angina. Dose: treat of deep vein thrombosis and pulmonary embolism by injection. Adult loading dose of 500 units. In severe pulmonary embolism, 1000 units. Prophylaxis in general surgery by subcutaneous injection. Adult 2000 units before surgery and then every 8 to 12 hours for 7 days. Pulmonary embolism is a condition in which one or more arteries in the lungs become blocked by a blood clot. Heparin side effects: heparin induced thrombocytopenia, hematoma, hemorrhage, immune hypersensitivity reaction. And thrombocytopenia is a low number of platelet in the